I think that's absurd advice. I mean, miscarriages are common enough. I mean, in women who are less than 35, even the miscarriage rate can be as high as 15 or 20%. And that's not infertile couples, just in general, women get pregnant. And then when they get older, like in their 40, it's as high as 35%. And when they're in their 40s, 44, it can be as high as 50%. Miscarriage is common, and it's usually not caused by any problem in the woman's uterus herself. Sometimes it is. It can be caused by a septum or some other defect. But the majority of the time, it's caused by the embryo just not being viable, and it dies, and so then it's discharged as it normally should be. So I don't know why someone would say to you not to try to get pregnant again. I'd have to know more details about it. But if there is a uterine problem, we can almost always fix it with surgery. And if it's an egg issue, then what we would do IVF to try to get better quality eggs, and Mini-IVF, of course. So I don't understand why you would have been told that, but maybe if I get more detail, I can help you more.